quality of life, and even impact mood and productivity. Okay, so Maria will explain all the trials that back these benefits, but this would be a very relevant summary of the main benefits of the. Importantly, irritable bowel syndrome, lactose and fructose intolerance, and stress-related diarrhea. The product was first developed for IBS, so you'll see it has a very detailed and characterized mechanism of action, but over time we've also seen that it works very well for other digestive pathologies like sugar intolerances and also all kinds of diarrhea that are functional or recurrent. Okay. So here I tried to summarize in one slide the most important messages related to the clinical evidence of the product. We've published 8 trials with i3.1. We've replicated the results in different ethnicities and also by independent investigators. This means that not all the trials that have been published with i3.1 have been supported by BIOTICS. We have a couple of them that independent investigators and good results. We've also tested the product as a co-treatment with drugs. This is interesting and not that common for probiotics. We've seen that the probiotic works very well combined with antispasmodics, which is, as you know, a very common treatment for abdominal pain. And as Maria also will explain, the product has a clinically tested mechanism of action in both in vitro and in vivo trials. This is also very rare for probiotics. You'll see many probiotics that are indicated for digestive health, but almost none of them explain how the probiotic works and how it impacts digestive well-being. So this is also something to take in mind and to promote when talking about the product. And also this last sentence, Maria will explain better, but i3.1 is the only probiotic shown to reduce visceral hypersensitivity, which is the abnormal sensation of pain in the gut that is very common in IBS patients and also other patients that suffer from functional gastrointestinal disorders. And this is also a key target for the treatment of these conditions. And this is the only probiotic so far that has clinically proven to reduce this key target, the visceral hypersensitivity. Okay. So this slide, we always try to put it here because it shows that the probiotic is recommended and backed up by professionals, by scientific medical societies. Over time, the list of medical societies that recommend i3.1 keeps growing. It first was the World Gastroenterology Organization, and right now other societies like the German Society, Polish and British Society of Gastroenterology recommend i3.1 specifically for the treatment of IBS and other digestive disorders. So this is very important when you're trying to convince doctors to promote this product in Iraq. Just make sure to highlight that it's being used worldwide and in Europe as well for these specific conditions. Okay. In the links here, you will have access to the guidelines that are recommending i3.1, and you can also check it by yourselves if you want. And also outside Europe, we've been having a lot of good recommendations for this product as well. In Canada and US, the probiotic appears in the clinical guide of probiotics that is published by an independent association called AI ProBio. And well, this particular product, due to all the evidence that it has behind, has been awarded the highest level of recommendation, which also gives visibility and recommendation of the product outside of Europe and in the US. Okay. So these two slides, I won't go in detail because Maria will explain, and you'll also have time to read the publications if you can, but this is only a summary to highlight all the evidence behind I3.1. We have 4 clinical trials that are randomized double-blind, and then other publications that are either observational trials, in vitro and in vivo trials. You have them here in 2 different slides. You'll see that here, if you take a look at the population column, the probiotic has been tested in patients that have IBS, also in healthy participants that have stress-related digestive issues, and in several different ethnicities as well. So this trial was made in Japan. We've also had this one in Mexico, this one in Spain, and so on. So the summary of the slide is that the probiotic has been widely studied, is one of the most studied probiotics for IBS for sure. And over this time, and the first trial was published in 2014, and from then to now we've been developing, and we've always been moving on and keep studying the product, which is also quite rare, to be honest. Okay. So yeah, if you want to take a look at the trials closer, this would be a summary for it all. This, for example, this trial that was published this year was done by an independent scientific group, and they did quite a big trial with good results as well. And that would be the summary of the studies that Maria will explain further, getting deep into specific results. So in this slide, I wanted to summarize who would benefit the most from this particular product, the consumer profiles. This would be only a summary, but this is also what we've seen works best in other regions and countries of the world. First of all, as you may already know, IBS is mostly suffered by women. Around 8% or 80% of patients that suffer from IBS are women. So the main consumer profile for I3.1 would be women with irritable bowel syndrome that are looking to prevent symptoms in the long term and maintain the chronic pathology under control. This particular patient profile would also benefit from combination treatment with I3.1, the probiotic plus antispasmodic. The probiotic would be taken long term for at least 1 month, but extended as long as the patient would need it, and then combine it with antispasmodics if the patient suffers from a specific abdominal pain moments, let's say. So we would take I3.1 to prevent acute episodes of symptomatology, and also combined with abdominal pain if the patient is in a lot of pain and wants, let's say, an immediate solution. Okay, you will see that probiotics work better on the long term. The only thing with probiotics is that they need to be taken consistently for at least 1 week or 3 weeks. They do not work like drug treatments that show an immediate response after an hour long, but they make sure that symptoms do not appear over time and to maintain chronic pathologies under control. Okay. As a second consumer profile, we would be talking about both men and women who frequently experience digestive discomfort, and this would be those patients that do not have a diagnostic of infectious diarrhea or gastroenterologist or other infectious pathologies, but that suffer from digestive issues without an apparent cause. This, for example, is worsened due to stress. So men and women that are stressed due to work or family issues that keep having diarrhea or constipation, abdominal pain, and all these kinds of symptoms could benefit from I3.1. And then finally, a third group of patients that are recommended to use the product are both men and women suffering from sugar, both fructose and lactose intolerances, because we have 2 publications that show that the product works to reduce symptoms of lactose intolerance and fructose intolerance. These are not allergies, but intolerances. So those patients that are suffering from this chronic condition that want to improve their quality of life and reduce the symptomatology over time would also be recommended to use I3.1. Something that all these patients have in common is that Treatment can be extended as long as needed, is completely safe since it's natural and it works over time. There is no limitation of use. So this is very good for those patients that want a natural approach to their disease and that do not want to keep taking drugs which also have side effects. Okay. So as a summary for I3.1, this would be our recommended USP. You'll see it's a bit complex, but because we have many probiotics for digestive well-being, and I3.1 concretely has been shown to fight back all those digestive disorders that are linked to psychological imbalances, which would be called functional gastrointestinal disorders. And this includes mostly irritable bowel syndrome, but also stress-related diarrhea and food intolerances as well. And here I'm introducing let's say a subject that it's a bit complex, which is the gut-brain axis. If you are not familiar with this axis, would be the communication between the gut and the brain. And what we've seen with this product is it has effects on the gut that also impact the brain, because we've seen in several clinical trials that patients that take the product feel better overall, improve their quality of life, and even have better mood and productivity. So a good way to differentiate I3.1 from other probiotics that are indicated for digestive health, is to highlight the fact that it modulates the gut-brain axis, and it's been shown in several clinical trials to improve symptoms of complex chronic digestive disorders. Okay, we sometimes call it the next generation probiotic for gut health because it differentiates from typical or traditional probiotics in this sense. Okay. Now, moving on to the other product, which we call AB Digest. This is also a probiotic for digestive health, but you'll see it has quite a different approach. And it does not only contain probiotics, but it also contains prebiotics, which are generally known as fibers, particularly fructooligosaccharides and inulin, and it also contains zinc. Because it has all this mix of ingredients, we say it's a symbiotic. That's the name that the industry uses to refer to mixes of probiotics and prebiotics. And this combination was made so that the final product has, let's say, heightened effects for this particular indication, which are sporadic digestive symptoms. This means infectious diarrhea or digestive symptoms that are from a specific cause, and mostly due to antibiotic use. Probiotics when they first developed many years ago, started to be used for this indication, and so AB Digest contains one of the most studied probiotic strain for antibiotic-associated diarrhea, which would be the main symptom that happens after taking antibiotic treatment. Many people suffer from this condition, and this is not only for antibiotics that are prescribed for digestive issues, but also antibiotics that are prescribed for anything. Okay, so this would really open up the patient pool that would benefit from AB Digest, that would be recommended anytime an antibiotic is recommended. Okay, the format for AB Digest are shots. It's a short treatment, only 7-day treatment, and sorry. The posology would also be once a day alongside with antibiotic treatment. What we recommend when taking any of our probiotics is to separate a bit the taking of the probiotic versus the antibiotic, because if you take it at the same time, probiotic growth in the gut might be reduced due to the antibiotic. So we always recommend to give the antibiotic first, and then at least 2 hours later the probiotic. For easy compliance, we recommend to do 1 in the morning and 1 at night. Okay. And then consumer profile as a summary would be mostly children, but also adults under any antibiotic treatment. Okay. I haven't said, but the images that you see here are real images, optic microscopic images of our particular strains. This is a bifidobacteria which has this particular shape, and in the other image you saw the pediococcus and lactobacillus strains of I3.1. Okay, we have many other images like this one if you are interested, but yeah, it's interesting to see what the bacteria look like. Okay, so as a summary of the key benefits of Digest, we have, as I said, 3 different kinds of ingredients mixed in one potent formula. On one side, we have the probiotics that are 3 different strains. When we talk about strains, we talk about types of bacteria. This Maria will explain much better, but each strain has particular benefits and properties. That's why it's always important to specify which probiotic strain is in a finished commercial product. Without this specification, probiotics can have anything on them, even things that are not good for you or that do not have any effects, okay? That's why we always specify which strains are on our probiotic formulas. To keep it short, I've only put the species in the presentation, but Maria will explain the particular strains, the code strains, okay? For the probiotic formula, we have Lactobacillus rhamnosus GG, which is the most studied probiotic strain for antibiotic-associated diarrhea. There are many meta-analyses showing the effectiveness of this product. Here I've put one of the many numbers that the probiotic has. It has shown to reduce the risk of antibiotic-associated diarrhea by 60%, okay? And the probiotic also, this product also has 2 other probiotic strains that are shown to improve gut dysbiosis, a bifidobacteria and a pediococcus, okay? Gut dysbiosis mainly refers to when the bacteria in the gut have lost diversity and have higher populations of bad bacteria, which promotes the disease and, well, all the digestive issues, okay? Just in very simple words. AB Digest also has 2 different probiotics, which are fibers that enhance probiotic activity and make probiotic growth better, and also support the growth of other gut bacteria, okay? And then zinc, which, as you may know, is recommended by the World Health Organization to reduce the duration and severity of diarrhea and also counteract weight loss, okay? So it's a very common and well-known ingredient also for doctors and other kinds of healthcare professionals to recommend in severe cases of diarrhea. Okay. In I3.1 here, I've tried to summarize the clinical evidence of AB Digest. We say it's an advanced symbiotic because it's a product that contains 3 different kinds of ingredients that have been clinically tested and formulated specifically to restore gut health and for the indication that I have explained. It contains the most studied probiotic strain for antibiotic-associated diarrhea and also diarrhea in kids, ensuring both high safety and, of course, exceptional efficacy. And finally, it's been backed up by science and endorsed by leading scientific associations worldwide. Okay, this slide summarizes medical societies that recommend probiotics for antibiotic-associated diarrhea. So this indication would be the mostly used and recommended indication for probiotics. It's been a while now that doctors recommend widely probiotics combined with an antibiotic treatment because it has been widely seen that it helps reduce the risk of diarrhea and other symptoms associated with antibiotic use. And since it affects almost a big amount of patients that are treated with antibiotics, is put in many guidelines and endorsed by prestigious international medical societies. This is a summary of some of them. So the World Gastroenterology Organization, also the EFSGAN, which is the European Society for Pediatric Gastroenterology, and also Russian Society of Gastroenterology, they all recommend the use of probiotics paired with antibiotic treatment. Okay, so at the end, you are promoting the use of products that is really endorsed worldwide by scientists. Okay, and just because I don't want to be much longer, these are the 3 consumer profiles that could benefit the most from AB Digest. Of course, these are not the only, but these are our recommendations and also what we've seen works in other markets. What we've seen works very well for AB Digest is to recommend it for patients, as I've said many times now, undergoing antibiotic treatment. But it's also very good for children, and also children that have recurrent digestive issues. For example, children starting daycare, they very recurrently and commonly get infectious diarrhea due to being close to other children. So for these children, during antibiotic treatment and also to prevent episodes of diarrhea, we would recommend AB Digest. And then all those adults that are mindful of their digestive health, that want something to strengthen their gut health and also the immune system, because as you may know, gut microbiota also impacts very strongly the immunity. So this would be the summary. The main difference from I3.1 is that this is a short treatment that should be recommended when patients are suffering from a specific symptom or combined with antibiotic treatment that normally also has a short treatment duration, okay, short duration. So also to summarize, the USP of AB Digest would be an advanced symbiotic that restores gut microbiota, promoting the populations of gut bacteria, promoting the growth of good bacteria, and also inhibiting the growth of bad bacteria. This would restore gut microbiota, so it has all their functionalities, and also prevents the appearance of digestive symptoms. And it's both recommended for children and adults to alleviate gastrointestinal symptoms and also strengthen immunity. Okay. Just as a summary, I've put here together both products side by side so that you can see a bit the differences. They would both be recommended for digestive issues, but quite different indications. The first one, I3.1, would be recommended for chronic digestive problems, those that keep coming back and cannot be cured, unfortunately, which would be functional gastrointestinal disorders like IBS, food intolerances, and all these digestive issues that appear without an apparent cause that might be exacerbated due to stress. And then Digest would be recommended for sporadic digestive symptoms that are linked to antibiotic use or infectious diarrhea that has a very clear cause, which would be a pathogen. Okay. Well, I won't go over the rest because we've already explained. I put here also the mode of action of both strains that Maria will explain better, but as a very, very big summary, I3.1 would strengthen the gut barrier, improving intestinal permeability. This would make sure that no pathogens go through the intestinal wall. And AB Digest is more focused on the growth of gut bacteria and modulating gut microbiota so that the gut is protected from antibiotic use. Okay. In this slide, I just wanted to highlight very quickly before we finish my part of the presentation, how you can differentiate I3.1 and AB Digest, which would be next generation probiotics, to other general and traditional probiotics that are in the market. Okay, probiotics have been in the market for many years, but not a lot of them can be actually considered probiotics and have really clinically proven effects. But as a summary, a next generation probiotic makes precise claims that are clinically proven, has specific strain codes on its composition, and also clinically verified CFU counts. This means that the amount of bacteria that is found in each capsule or shot is the same that has been tested in clinical trials and is also verified. A lot of CFU does not equal a lot of efficacy. The only thing that matters here is if there is a clinical trial behind. And then also there are many guidelines that explain what probiotics should be and should look like. And many products that are in the market do not adhere to probiotic guidelines that have been developed by the World Health Organization and the International Society of Probiotics and Prebiotics. Okay. If you want to look at this further, maybe we can talk it in another, we can discuss it in another call. And also what is interesting over time after you start promoting the product is that you come back with the competitors that are specific from your markets, so that we can do an analysis and see how our products can be highlighted or are better than the competition, okay? And well, these two slides, I was trying to summarize the main doctor specialties that, well, can recommend and prescribe the product would be gastroenterologists, general practitioners, even gynecologists and pediatricians. I've summarized here how and in what situation each doctor can recommend each of the products. Is a bit what we have explained, so I won't go in detail into it, but basically for gastroenterologists, you would be recommending the product for patients that have IBS and digest to prevent or treat infectious diarrhea. For GPs would be more all those patients that are suffering from digestive disorders related to stress. For I3.1 and for digest to pair any time that the general practitioner recommends an antibiotic. Gynecologists are an interesting specialty because they treat, of course, women, and women are the main population that suffer from IBS, as I have explained. Sometimes IBS can be linked to hormonal cycles and also stress issues. So gynecologists could both recommend I3.1 and also digest for women that need to start antibiotic treatment for urinary tract infections. This is a very interesting also patient profile since UTIs, as you know, urinary tract infections are always treated with antibiotics. AB digest could also be recommended as a co-treatment to prevent digestive issues associated with antibiotic. And then pediatricians could also recommend both products, I3.1 for children with mild food intolerances, and digest for children that have antibiotic-associated diarrhea, as I have explained, or infectious diarrhea. Okay, and that's it. I did not want to be very long. I hope you enjoyed the presentation. I suggest maybe that we move to Maria, which will explain the evidence of the products, and then we can do a round of questions, if that's okay.
Okay, thank you, Claudia. I don't know whether there is a comment or a question or no. Because we are okay. So we are moving Maria. Now.
Yes.
Yes,
yes, sorry. Continue. Yes. Okay. We will continue with you, Maria, and then we will ask our question if our team have some of questions.
Perfect. Perfect. So we are moving now to the scientific part of the presentation. This part is more like dense, a bit dense. Well, we will try to summarize the evidence for both products, I3.1 and AB Digest, because there is a lot of scientific evidence. So I've tried to summarize, but it's also good to know because our promotion is based on scientific evidence. So we think that it's important also that you know all these data. The positioning of both products, I think that was very well described by Claudia. So i3-1 is a product that modulates gut-brain axis. So, and it is intended for functional gastrointestinal disorders. So there is a component, a physical component in the gut, but also a psychological problem. And well, we find, for example, this particularly in irritable bowel syndrome, also in a stress-related diarrhea, but also there are other digestive problems such as lactose intolerance that also share common threads with these conditions. And then AB Digest is another product that is more intended for diarrhea, to treat diarrhea of infectious cause, or to prevent antibiotic-associated diarrhea. So we will review in detail the scientific evidence for these two products. Starting with i3-1, you know that it's a product that contains 3 probiotic strains, 2 Lactibacillus plantarum and 1 Pediococcus acidilactici, with specific code strains. And well, we will follow this outline here that is presented here. We will make an overview of irritable bowel syndrome. Then we will evaluate the role of probiotics and general characteristics of probiotics. Then we will review very quickly the mechanism of action of i3-1, scientific evidence for this product. We will review also specific clinical trials, and then at the end we will have the key messages. Well, irritable bowel syndrome, it is a functional gastrointestinal disorder, so chronic, with periods of relapse and periods of better, where the person feels better. And it is included in ROM4 criteria. This is a group of experts that meet every 5 years to define diagnostic criteria for functional gastrointestinal disorders. So in the ROM4 edition, irritable bowel syndrome was defined as a recurrent abdominal pain associated to changes in the frequency and appearance of stools that occur at least 1 day in the week in the last 3 months. So it's basically these 2 components, abdominal pain and alterations in the defecation habits. It is a very prevalent condition. It affects like almost 600 million of people in the world. However, the patient with IBS, it's very difficult sometimes to achieve the diagnosis of IBS. So that usually this type of people go from one doctor to another doctor. So it's and it's difficult to identify because it's a multifactorial cause or disease. So it's difficult to reach the diagnosis. Also, there are different presentations of the disease. So in some presentations, we have predominant diarrhea. In other presentations, we have predominant constipation. And in other, we have mixed presentation. So some periods of diarrhea with some periods of constipation. And there is a 4th category that is unclassified IBS. Well, as we said previously, it is a disorder of the gut-brain interaction. So there are some component in the intestinal mucosa, some kind of inflammation that is not evident at systemic level, but only in the gut mucosa. And also there is a psychological component that is also very relevant. And for example, that produces a lot of anxiety in this type of people. They usually, for example, have problems with social activities because they are always thinking about problems with their digestive problems. So this difficults a lot to have a normal life, especially when they have a relapse. So, as I said, the etiology of irritable bowel syndrome is multifactorial. So there is no only one cause. There are genetic factors. There are also environmental factors. There are psychological factors. But some of the components of IBS are very related with the gut microbiota. So we have, let me. So we have gut dysbiosis that was defined very well by Claudia before. So it's a loss of diversity of the gut microbiota. There is an alteration of the normal composition of the gut microbiota. And there is, due to this gut dysbiosis, there is an increased intestinal permeability. This causes that some toxins produced by bacteria in the gut enter to the intestinal mucosa and cause an inflammation. And then we have also alteration of the mucosal immune system. And all these facts also cause what is called visceral hypersensitivity. So these are normal physiological stimuli that everyone has in the bowel, in the bowels. However, in people with IBS, these normal physiological stimuli cause pain. So they have this. This is the typical symptom of IBS. So they have chronic abdominal pain. Of a cause that in normal people do not produce pain, but they have this sensation of pain. Well, so probiotics were proposed for the treatment of IBS since long time ago. This is the probiotics definition. According to the FAO World Health Organization, probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit to the host. We know that the benefits of the probiotics are strain specific, so we cannot generalize from one Lactobacillus plantarum to other Lactobacillus plantarum. So, you know that the strain is this code with numbers that we put after the name of the bacteria. So, for example, Lactobacillus plantarum is the name of the bacteria. When we say CECT 74A4 is the strain code, and this strain code relates directly to the properties of that bacteria. So these effects cannot be generalized to any Lactobacillus plantarum. So these are the conditions that were defined in the first guidelines for probiotics. So we know that strains have to be well identified and have to be deposited in international culture collections. All the probiotics have to be safe. This is an essential condition for probiotics. So, and this is assessed at genetic level. This is assessed also at clinical level and at molecular level. And we need that all probiotics are supported by clinical studies, clinical studies performed in humans. And we know that the best designs for clinical studies is that is randomized. So patients are assigned in a random way to different intervention groups. And then those control with placebo. So when there is an arm of the study that is where the patients receive placebo instead of an active treatment, this allows to control very well the effects of the product. And finally, it is necessary also to evaluate the mechanism of action of the probiotic. This is also stated in the guidelines for probiotics, and also you will see that all our strains, probiotic strains, are very well characterized at this level. So we evaluate always the mechanism of action in relation with the condition that we want to treat. Nowadays, we have also different organizations, other organizations, a part of World Health Organization, that also establish guidelines for probiotics. One of them is the International Scientific Association for Probiotics and Prebiotics, the ISAP. and the other one is the World Gastroenterology Organization. So these are always reference documents for our products and also for us to develop new products for a new condition. Well, in the case of I31, we have very well these 3 probiotic strains. Also, we have evaluated safety at different levels. So these probiotic strains are deposited in the Spanish type culture collection. That's why the strain code has this CECT. This is the Spanish type culture collection. This refers to the Spanish type culture collection. Then we have evaluated very well that these strains are able to survive the gastrointestinal conditions. So when taken orally, they are able to reach the gut and exert their effect in the gut. And also they have shown good adhesion properties to the intestinal epithelium. So this means that they can colonize transiently the gut. This is very important to exert also the effects. They have also a lack of antibiotic resistances and do not produce undesired compounds. This has been evaluated, as I said, genetically, but also through international approved methods. We know that they do not have also this undesirable activity, so no hemolytic activity, no gelatinase activities. They do not have adverse events, neither in studies conducted in animals nor in studies conducted in humans. And they have the qualification of QPS by the European EFSA. QPS refers to quality presumption of safety. So it's a list of positive species bacteria that are considered safe by this European organization. And also they have the GRAS status by FDA, that is the American organization. Well, so for IBS, for the 3 strains that are part of I31, we have very well characterized the mechanism of action. This is just a slide to summarize all the evidence that we have, but we can, in future sessions, we can go deeper into this mechanism of action. But it's good that you know that some of these strains, especially both Lactobacillus plantarum, produce what is called polyphosphates. These polyphosphates are molecules that are secreted in the gut by these probiotic bacteria. They are internalized by the epithelial cells of the gut barrier. And what they do is to these polyphosphates within the cells, they activate different metabolic pathways that keep the cells in good health. So they promote the integrity of the gut barrier in the end. Also, we know that some of the strains of I31 have an anti-inflammatory effect. They produce acetylcholine, or they produce short-chain fatty acids, also at the gut level. And these molecules have an anti-inflammatory effect through different mechanisms. Okay, so but especially these 2, Lactobacillus plantarum, have the ability to secrete this acetylcholine and short-chain fatty acids. And also, they have antipathogenic effect. We mentioned before that in IBS we have a gut dysbiosis, so an alteration of the gut microbiota composition. And in this gut dysbiosis, some potential pathogens, pathogenic bacteria such as Streptococcus, are increased. So we know that our the 3 strains in I31 are able to counteract the growth of these pathogenic bacteria. So once they are ingested and taken orally in the gut, they are going to counteract the growth, and correcting the dysbiosis that is associated with IBS. This is a summary of preclinical and clinical trials with I31. We have an animal model study that was published in 2016. Then we have also communication about a mechanism of action of I3.1 strains. And then we have clinical trials, so like up to 6 clinical trials. We are not going to review today all of them. We are going to review the most important ones. But just to let you know that there are 6 clinical trials. We will share with you the publications. And if you have or you want a second session, or you have any question regarding the trials, you can contact us. We are also performing another trial. This is an ex vivo study with IBS patients that are undergoing colonic biopsy. And well, we are extracting these biopsies, and with the tissues, we are evaluating also the effect of I3.1 in the gut barrier integrity. So this is also a very important study that is about to be published, and it's published with very well-known European group that is a leader in this in IBS. Well, so we will review some trials. As I said before, one of the trials is this one that was performed by a Spanish group. This was our first trial with I3.1 in IBS patients. It was a multicentric, randomized, double-blind, placebo-controlled trial. So double-blind means, as you know, that neither the investigator nor the patient know what treatment has been assigned. And placebo control means that we have, in this case, we had 3 arms. One arm received I3.1 in high doses. Other arm received I3.1 in low dose, but then the third arm received the placebo. So placebo means that they received a capsule, but there was no probiotic within the capsule. Okay, and they received 1 capsule per day over 6 weeks. They were patients diagnosed with IBS with a component of diarrhea or with a mixed presentation. And of course, in the study, we could not accept any patient that was taking already another probiotic or that was taking any antibiotic at the moment of inclusion or other interfering medication. Or also, we excluded those patients who had other types of gastrointestinal disorders or diseases with similar symptomatology, such as, for example, celiac disease or inflammatory bowel disease. Well, so we followed these patients over 6 weeks with also medical visit at midterm at 3 weeks. And we evaluated IBS quality of life. This is evaluated with a questionnaire, with a validated questionnaire related to different aspects of life. So not only physical gastrointestinal symptoms, but also mental health, work activity, sexual life is evaluated through this questionnaire. And also we evaluated what is called visceral sensitivity through also a validated questionnaire that is visceral sensitivity index that evaluates also this anxiety related with gastrointestinal symptoms. Well, and in this slide, I show the main results of this trial. And of course, the groups were well balanced at baseline. And what we observed here in the left, you see IBS quality of life results, and you see that both groups receiving probiotic, both either the high dose or the low dose, even with the low dose, there was so better score. But both of them were much, well, quality of life was significantly improved versus placebo. When we also calculated regarding this score of IBS quality of life, when we evaluate, we calculate the percentage of good responders, poor responders, or non-responders, What we observed also is that both groups receiving probiotics had a high percentage of good responders in comparison with the placebo group. So half of the patients, or more than half of the patients treated with I31 were considered good responders at the end of the intervention, whereas only 17% were considered good responders with the placebo. Well, another evaluation in this first clinical trial was visceral hypersensitivity, and we also observed that at 6 weeks, after 6 weeks of intervention, both probiotic groups, high dose and low dose, had improved significantly visceral hypersensitivity in relation with placebo. And very interesting was that visceral hypersensitivity correlated very well with the IBS quality of life score. So improvement in one questionnaire correlated very well positively with the improvement in the other scale. Well, this is the second clinical trial with IBS. In this case, the trial was also randomized, was single-blinded. I will explain you why in this case only the investigator was blind, and was a placebo-controlled trial as well. So in this trial, we had also 3 arms. One arm received probiotic, the other one received placebo, and the third arm received probiotic with antispasmodic, which is a common treatment also for IBS. And in particular, the antispasmodic used here was a combination of alberine citrate plus simeticone. So here also we had patients with IBS-D and IBS-M. We excluded also the same type of conditions as I mentioned in the previous trial. And we here evaluated the patients at baseline, at day 0, but also after 6 weeks of treatment. And we evaluated as well IBS quality of life. We evaluated, in this case, abdominal pain with a visual analog scale. This is a scale from 0 to 10. And the patient has to mark a higher score if the symptoms or the pain is higher. And then we evaluated also stool consistency, so the type of diarrhea with a very well-known scale that is the Bristol scale. Well, so also here groups were well balanced at baseline. And what we observed is that in both for abdominal pain and for diarrhea, the groups that received probiotic had a much higher percentage of responders in comparison with placebo. So for abdominal pain, we also observed that the group receiving the combination of probiotics with antispasmodic had even higher results than with probiotic alone. This is as expected, because antispasmodics also target abdominal pain specifically. So the combination was better than probiotic alone, but probiotic was better than placebo. And for diarrhea, there was no significant difference between the 2 probiotics groups, because antispasmodic has not a specific effect on diarrhea, but probiotic has a specific effect on diarrhea. So we had these 2 probiotics were significantly better than placebo. And here you have also the percentage of responders in all groups. And as you see here, the percentage of responder was 50% in the group receiving only probiotic, 68% in the groups receiving probiotic plus antispasmodic, and only 17% in the group receiving placebo. So much better results with in the 2 probiotic groups. And it is interesting also to compare the results between the clinical trial 1 and 2 that I mentioned now. And even if they were completely independent trials in different ethnicities, in different countries, different investigation groups. We had very similar efficacy results. So the number needed to treat, the number of patients needed to treat, which is a number or an indicator that is used to evaluate the efficacy of any drug. So the number needed to treat was around 3, 2.6 or 3 in the second. The percentage of responders was very similar with the probiotic and also similar in the placebo. So the results were very, very robust between the two clinical trials. Well, a third clinical trial that I wanted to highlight today is the trial in people with diarrhea, suffering from diarrhea related to stress. This was also randomized, double-blind, placebo-controlled trial that was performed in Japan. Patients or volunteers here received I31 in the usual standard dose for 4 weeks. And well, some patients, of course, were some conditions were excluded for the trial. Some confounders were excluded from the trial. And here the outcomes were also digestive symptoms related and the quality of life. In this case, we used a Japanese validated scale, mental health, productivity, and gut microbiota. And the results also showed that in those in the Izumo scale that was related with quality of life, those questions related with diarrhea, the group that received probiotic had a significant improvement in comparison with placebo. Also, there was a significant improvement in mental health and also in productivity that related with this improvement in the symptoms. And the fourth trial is the one in lactose intolerance. This was also a trial in comparison to placebo, where patients that had been diagnosed of lactose intolerance for the diagnosis, the test, the typical test to identify this condition is the lactose hydrogen breath test. So they underwent this test. They received 25 grams of lactose, and then they evaluate the symptoms after receiving this high dose of lactose. Usually these patients have problems to digest the lactose, so the lactose reaches the colon in intact form, and in the colon the lactose is fermented, and because of osmotic effect, this produces diarrhea and a lot of gastrointestinal symptoms in these patients. So symptoms were evaluated through a validated questionnaire. And once we confirmed that those patients had lactose intolerance, they were randomized into 2 groups, one group receiving probiotic, the other receiving placebo for 2 months, 8 weeks. And after this period, again, another test was performed and symptoms were evaluated. And what we observed here is that also there was an improvement, a significant improvement in the symptomatology of those patients who had received the probiotic, especially in the reduction. There was a reduction in abdominal pain, in flatulence, and almost also, well, there was a trend in diarrhea. It was almost significant. Okay, so also it was important that 46% of the subjects in the probiotic group, but no patient in the placebo were considered responders. So this was a reduction of 50% at least of the symptoms related with this condition. Well, so based on these publications, and as Claudia mentioned before, we have I31 in different international clinical guidelines. So this is important, I think, in the promotion of the product, because usually clinical guidelines are to make closer these studies to all the physicians. So it's a way promote this among primary care physicians, for example, who do not have time to read the papers. However, clinical guidelines make all the evidence simple for these doctors. So it's important also to promote, to use these guidelines in the promotion of the product. Well, this is a summary of key messages, scientific messages related with i3.1. So it's a combination specifically developed for people with IBS and other functional gastrointestinal disorders. It has demonstrated through clinical trials that reduces the main discomfort associated to IBS, so abdominal pain, also diarrhea. It is recommended by different guidelines. Improves quality of life and reduces symptomatology associated to this condition. Also, we have evidence in lactose intolerance, which is very common, we know. And well, it's also important to highlight that i3.1 is the only probiotic with a proven effect on visceral hypersensitivity. So this is this exaggerated perception of pain through of normal physiological stimuli. And also, we know that the combinations of probiotic with antispasmodic, which are also drugs commonly prescribed for IBS, is even more effective and allows for an improvement of IBS. Well, so this is everything for i3.1. We move now through to AB Digest, which is the probiotic formula for acute gastroenteritis and prevention of antibiotic-associated diarrhea. Also, we will evaluate. We will see a bit of the pathophysiology of these conditions, and then we will evaluate AB Digest and also the evidence for and all the components of AB Digest. Well, acute gastroenteritis is a common condition, especially in children less than 5 years of age, but also in older people. Usually in children, etiology of infectious gastroenteritis is of viral origin, being rotavirus more prevalent than norovirus. However, in those regions where we have a vaccine, rotavirus vaccine very prevalent, norovirus is also taking a lot of relevance. And also in adults, we have norovirus more prevalent than rotavirus. Bacterial infectious gastroenteritis is also possible, but not so common. It's around 20% of the incidence of gastroenteritis is due to bacteria. Okay. Another condition is antibiotic-associated diarrhea. We know that antibiotics are very important or have improved survival over the last century, so they are very, very important drugs. However, they have also secondary effects, and one of the most common secondary effects of antibiotics is diarrhea associated to their intake. So this diarrhea can appear during the antibiotic use or even after the antibiotic use has finished. And it is calculated that around one in three persons develop diarrhea associated to antibiotic intake. So either if we have an infectious gastroenteritis or we have a diarrhea associated with antibiotic treatment, what we will have at the end, in the gut is a dysbiosis. So we have already discussed about dysbiosis. We have a reduction in the diversity of the gut microbiota, but also an alteration of the gut microbiota composition. So where usually the good bacteria, so the lactobacilli, the bifidobacteria, are reduced, whereas other bacteria that are considered like pathogenic, such as Clostridium, Campylobacter, Enterococci, for example, they are increased. So we know that bacteria are not just bacteria, they produce a lot of metabolites, And when we have this dysbiosis, what happens is that bacteria produce metabolites that are toxic and that can disrupt the intestinal barrier, and this causes inflammation, and this also worsens all the gastrointestinal symptoms that are associated to these conditions. Well, so we developed also AB Digest for specifically for these two conditions. AB Digest has this composition has lactic acid Bacillus rhamnosus GG. This is the new taxonomy. In the old taxonomy is Lactobacillus rhamnosus GG in 5 billions. We will explain that Lactobacillus rhamnosus GG has a lot of evidence in gastroenteritis and diarrhea. Then IB Digest has also Bifidobacterium longum and Pediococcus pentosaceus. These are 1 billion in 1 billion. And these are strains that you will see when you hear about AB colic care. You will see that we have evidence in infant colic, but also we have evidence that they restore the gut microbiota composition. AB Digest has also zinc for the compensation of losses of diarrhea of this mineral, which is also important, and contains also probiotics such as FOS and inulin that facilitate the probiotic colonization and the growth of bifidobacteria. So they restore again also the gut bacteria. Starting with Lactobacillus rhamnosus GG, this is as I say, one of the most studied probiotics in the world. Has like around 200 publications, and different guidelines recognize that Lactobacillus GG has high evidence for the treatment of acute gastroenteritis, antibiotic-associated diarrhea, but also for nosocomial diarrhea and functional bowel pain. This, for example, the World Gastroenterology Organization is collecting this evidence, but also SPEGAN guidelines that are specific for children also have Lactobacillus GG, rhamnosus GG, for the treatment of these conditions. Lactobacillus rhamnosus GG today, because it has been, it was developed and commercialized long time ago. So today is like we can consider it like a generic strain. So there are a lot of Lactobacillus rhamnosus GG in the market, but not all of them are like authentic or similar, completely similar to the original one. So we have sequenced the strain that is contained in AB Digest, and we guarantee that our Lactobacillus rhamnosus GG is 99.999 identical to the original Lactobacillus rhamnosus GG. So all the functions, all the functionality of this strain is maintained in the strain that is contained also in AB Digest. And also we have performed phenotypic tests, so tests in the laboratory to confirm that also the functionality, so not only the genome, but also the functions of this Lactobacillus GG is like the original one. Also, the mechanism of action of Lactobacillus rhamnosus GG is very well studied, and there are a lot of publications. We know that this strain is able to increase mucin secretion at the level of the gut intestinal epithelium. So this, you know that mucin is also a barrier that helps to counteract infections. And also, Lactobacillus rhamnosus GG increases epithelial cell survival, reinforces tight junctions. Tight junctions are proteins that keep all the cells of the epithelium well linked. So, so they maintain the good integrity of the gut barrier. And also, Lactobacillus rhamnosus GG secretes proteins that stimulate lymphocytes B and also the production of IgA, which has antibacterial properties as well. Well, there are even meta-analyses that confirm the evidence of Lactobacillus GG in infectious diarrhea, especially caused by rotavirus. And the duration, these meta-analyses indicate that Lactobacillus GG is able to reduce 1 day the duration of the diarrhea. They may seem to you not very relevant, but indeed it is very clinically relevant, especially if we think that most this diarrhea affects specifically to infants. So in one day of diarrhea in an infant is a lot, is very clinically significant. It's very important to avoid dehydration so it's really clinically important. And also what is very recommended is that this strain is has to be taken at the same time of, so as soon as possible when the diarrhea starts. Also, for antibiotic diarrhea, we have evidence that Lactobacillus GG is one of the most efficacious strain. Also has very good tolerability. So the profile of Lactobacillus GG is very good in comparison with other strains that also have evidence for antibiotic-associated diarrhea. Well, and it is important also that to mention that Lactobacillus GG, although it performs very well in the prevention of diarrhea and or the cure of diarrhea, however, Lactobacillus GG is not able to improve the gut dysbiosis. So when we administer Lactobacillus GG together with antibiotics, patients recover very well from the diarrhea. However, the gut dysbiosis does not improve. That's why we need the second component of AB digest, which is this combination of Bifidobacterium longum and Pediococcus pentosacceus. These two strains are, well, Bifidobacterium longum is one of the bifidobacteria. You know that bifidobacteria are very important in the life because they are very related with the development of the immune system. So they are very relevant in the very early stages of the life when we are babies. However, when we are adults, bifidobacteria reduce the proportion, but some of these bacteria, for example, Bifidobacterium longum, we find this bacteria over all life course. So it's some of these some species of Bifidobacterium are important during all our lives, and Bifidobacterium longum is one of them. We have tested that these Bifidobacterium longum and Pediococcus pentosacceus have good probiotic properties. So they have very good resistance to gastrointestinal conditions. So they can reach the colon and the intestine alive. And also they have shown good adhesion properties to human intestinal cells. So these are basic properties to exert their beneficial properties. But also regarding the mechanism of action of these strains, we know that these two strains promote the tight junction proteins that, as I mentioned before, keep these epithelial cells in the intestinal barrier very well tight. So they keep the integrity of the intestinal barrier and avoid that toxic substances in the lumen of the intestine go through to the organism. Another important effect of this combination of bacteria is that they have antagonistic activity against common pathogenic bacteria, such as Salmonella, Klebsiella, Escherichia coli, etc. So they have shown very good antibacterial properties against all these pathogens. So here you have some experiments. There is a publication of 2022 that collects a lot of the mechanism of action of Bifidobacterium longum and Pediococcus pentosaceus, and this figure comes from this publication. You see this is the growth, the percentage of inhibition, and you see that this probiotics has almost 10% of inhibition of the pathogenic bacteria. And another relevant aspect, in this case relates to Pediococcus pentosaceus, is that this probiotic strain has anti-inflammatory activity against bacterial LPS, which is a common bacterial endotoxin. So Pediococcus pentosaceus, what we know is that promotes the secretion of one anti-inflammatory compound, protein, that is IL-10. And through this mechanism, Pediococcus pentosaceus counteracts the inflammation. Well, regarding zinc, the other component of IV digest, we know that during diarrhea, either of infectious disease, of infectious origin, or because of association with antibiotics, during diarrhea we lose a lot of micronutrients, and one of them is zinc. So one of the purposes to provide zinc is to compensate for the losses associated to diarrhea. But also zinc has a very important immune function and has demonstrated also an effect in improving the gastroenteritis duration and the symptoms. So this is one very well-known study with more than 18,000 cases of diarrhea, where the administration of zinc demonstrated a reduction in the duration of the diarrhea lasting more than 3 days. So they reduced the proportion of patients with longer duration of diarrhea. Also, they demonstrated to reduce the number of stools per day, and well, it is also acknowledged by the World Health Organization that zinc is one important component to counteract diarrhea effects. Also, zinc has important immune properties. So, for example, here in another study, zinc in combination with rotavirus vaccine demonstrated that increases the response, so the number of antibodies against rotavirus after the vaccination. So it has also these immune properties that are important also to counteract in cases of diarrhea. And finally, AB Digest is a symbiotic, as Claudia mentioned before. So it provides prebiotics, in particular a combination of fructooligosaccharides and inulin. You know that prebiotics are consumed by the good bacteria in the gut, so by bifidobacteria, lactobacilli, and promote their growth. And well, especially bifidobacteria are one of the bacterial groups that grow in combination with prebiotics. Also, at the time that these bifidobacteria consume prebiotics, they produce short-chain fatty acids that have this anti-inflammatory effect, and and are very important to keep the health of the gastrointestinal system. Well, so these are the key messages also associated to AB Digest. So AB Digest contains Lactobacillus rhamnosus GG, which is genetically and phenotypically equivalent to the original Lactobacillus rhamnosus GG, which is recommended by the World Gastroenterology Organization. It contains also other probiotics, Bifidobacterium longum, that help to counteract the gut dysbiosis and to promote the growth of bifidobacteria at the gut level. This has associated immune effects. Also contains Pediococcus pentosacceus that has this anti-inflammatory effect against the LPS, which is the typical bacterial endotoxin. Provides zinc that helps to compensate the losses due to diarrhea, but also has immune effects, important immune effects, and also contains prebiotics such as inulin and fructooligosaccharides to promote the growth of bifidobacteria at the gut level. It is convenient because it's the form, it is one shot in a day. And the taste is very pleasant, so it's also suitable for children and obviously also for adults. And that's everything regarding the scientific presentation. So if you have any questions regarding the positioning, marketing of the product or the scientific evidence, it was really difficult or challenging to summarize all the evidence in one session. Which should not be very long because it's difficult to keep attention for such a long time. But of course, we can share with you presentation.
That, Maria, yes. We will appreciate if you can share with us the presentation in order to keep us in now, in order to save the time. Dr. Ali, you hear me? Yes, Mike, the mic is yours. You can ask if you have or one of your team have any question, you can ask. Yeah. Yes, he asking about the age. The age, how we can use i3 and AB Digest.
Well, IB Digest can be taken both by children and adults. So it's a product that the dose is the same for all the populations. I know that doctors usually are used to adjust the dose of the products of many drugs for children and adults, but for probiotics, this dose adjustment does not apply. So it is the same dose for children and adults. Okay.
Maria.
Yes. You can take probiotics are completely safe for infants. The only exceptions are those children who are immunocompromised. So this is really either under cancer treatment or who have a primary immunodeficiency or any condition that makes them immunocompromised. Also, another exception for the use of probiotics are those children having or those people having short bowel syndrome. In those cases, it is better to avoid the use of probiotics because, well, of potential sepsis problems. However, a part of these very specific conditions, which are not of high incidence, probiotics are safe, completely safe for children from the first day of life. You have, I don't know whether in Iraq you have infant formulas supplemented with probiotics as well, but they are very common in Europe at least, and they are from the first day of life. For I31 we have for I31, which is more related with IBS and lactose intolerance or stress-related diarrhea. These are conditions which are typically in adults, so they can be taken the studies are performed in adults, so the age of prescription would be adults, or adolescents, for example, that because IBS is already prevalent in a certain proportion in adolescents, so it could be used also in adolescents, no problem at all. Yeah, vitamin D is included in I31. Is that right?
Why we adding vitamin D3 in I31? What the benefit of adding it?
Yes, Claudia.
Yes, so vitamin D is another ingredient that has shown benefits on the gut. What I know, maybe Nastia or Paul can also add here, vitamin D has approved EFSA claims for general health. That's why we normally include it in the formula. So it has an extra benefit besides the probiotic to support gut health and immunity as well.
Mm-hmm. Yeah, and a part of having an effect on immunity has also effects in IBS in particular. So there are studies in IBS, even a meta-analysis, I think, showing that vitamin D improves the symptoms of IBS. So it has both immune and IBS effects. Helicobacter pylori, you mean? Mm-hmm. Yeah, well, we do not have clinical evidence. In Helicobacter pylori, it is one of the conditions that is relatively common and causes gastrointestinal effects as well. It could be used. However, we do not have clinical evidence for that. Okay, so
sorry, Dr. Ali. Maria, sorry. Why we don't have a clinical evidence on H. pylori?
Well, we have not tested. We have a lot of products and a lot of and you have seen that we have already tested a lot of conditions, gastrointestinal conditions with I31 and also IB digest, but we do not have a specific evaluation performed in Helicobacter pylori infection. This is one of the ideas that we have to test in the future, but we don't have evidence right now.
I just want to add, if you would like to recommend AB digest for this particular indication, you could explain the mechanism of action of the product, which in turn would probably benefit these patients, although we do not have the publication, the clinical trial yet.
Mm-hmm.
According to your knowledge, Claudia or Maria, according to your knowledge, do you have or do you think that it will be our product will be benefit in this case?
Well, Maria, go ahead. Yes.
No, I'm not aware of, well, because we have, sometimes we do tests in the laboratory. I'm not aware of any test performed in the laboratory with our strains. However, let me ask to our R&D team whether they have they have done in any moment any test against Helicobacter pylori, and if we have some evidence on that. Okay.
I would say theoretically, since H. pylori is treated with antibiotics, digest could work well in combination with antibiotics. Although we do not have a clinical trial to support this, the mechanism of action of the product and the benefits that shown in other indications would suggest that it would work well in combination with antibiotics to treat H. pylori. But as Maria said, we can go back to our R&D team and get back to you with a more research-oriented response.
Well, so AB digest is 7 days is the usual recommendation. However, for I31 is 8 weeks because I31 is more indicated to treat chronic functional gastrointestinal disorders. So these are long-term conditions, and well, we need 8 weeks for the probiotics to make this adjustment of the gut bacteria, and also to have to exert their effect completely. However, we also, with the I31, I have to mention that at 3 weeks we have already some beneficial clinical effects. Okay, we have followed our patients in our studies for 6 weeks, and we have at 6 weeks we have even better results than at 3 weeks. However, at 3 weeks we observed already a clinical improvement.
So Maria, when we starting promoting or marketing the I31, we should tell, or we should know that the I31 will we will see the effect after at least 3 weeks.
Yes.
So we don't have any evidence before. We don't have any evidence that it work within 1 week or 2 weeks or even less than 1 week.
So the only it's not evidence. We have simply seen after testing the product in several markets that doctors say that patients observe benefits before the 3 weeks, even after 1 week. But what we can show in a paper, in an article, the clinical evidence that we have says at least 3 weeks until we see significant differences versus placebo. So I would recommend that you tell doctors to try the treatment and ask patients when they start seeing the results, because most likely they will see the results before the 3 weeks. But if you want the evidence, it's 3 weeks.
Do you have any other question, Dr. Ali, or any of your team?
They are discussing in the room.
They preparing a questions. So
thank you.
So Maria, Claudia, thank you so much. Appreciate your time. And of course, I will appreciate if you can share with us the presentation. After this, we will start a new training, of course, with our team. And maybe we have other question. We will share it with you in order to, if you have any other questions. Okay. I just have one more question. It's regarding the marketing question for IB Digest. Why we isolate the probiotic from the solution? Why we? I mean, it's regarding the stability of the product or what?
Yes. So probiotics are lyophilized. This means that all the water from the probiotic is taken out in order to be stable so that they do not die. And so when we mix it with the liquid that is found in the vial for AB Digest, you need to take it straight away, because otherwise the CFU, the probiotic counts, are not maintained over time. That's why it's separated. So that way it's stable and it can be stored in room temperature for 2 years and maintain the same quantity. Yes, so that's why you have to push and mix the powder, which is the probiotic, with the rest of the ingredients, which is the liquid, in order to take it.
So what the difference between is, we will talking about IB Care actually tomorrow. Mm-hmm. But what the difference between IB Digest, we isolate the probiotic on the solvent, and IB Care, which is already a suspension or solution?
Yes, AB Care is in an oil solution, which allows the stability of the probiotic. AB Digest is in a water solution that contains other ingredients to make it taste well. So that's why the difference between both formats. Mm-hmm. Very.
Sorry, Claudia, we lost you for a while. Could you repeat this last?
No, I think that's it. It's very simply explained, but that would be the difference. So AB Colicare only contains the sunflower oil, the probiotics, and the vitamin D, which is completely stable when mixed. AB Digest contains a water solution with other ingredients to make it taste well, and that's why it needs to be separated from the probiotic, which is in powder format.
One other more questions, which is very important to me and to for my team also, regarding AB Biotics strains. Is a unique strain to AB Biotic, or the same strain will we see on other company?
Yes, so all the strains are patented, patent protected, and they are only being sold to you in Iraq. So you won't see the same strains in other products on the market besides Lactobacillus rhamnosus GG. This is a strain that has been in the market for many years and does not have a patent. The patent is expired. So you might see other probiotics in the market with LGG, but with the combination of the other two strains, no. So LGG combined with the Bifidobacterian Pediococcus strain is a unique formula that will only be, distributed by Cele Pharma.
Finally, I will appreciate, Claudia, if in a brief, now if I asking Claudia to give me the strongest point to market it, AB Digest or I31, for example, in a brief, what Claudia will say.
Okay, the most important message for each of the products, you mean?
Yes.
Yes. So I would say AB Digest, probiotic and prebiotics for antibiotic-associated diarrhea and other infectious diarrhea. So short-term treatment to take when taking antibiotics or when feeling unwell due to diarrhea or other infectious diseases. This would be for AB Digest. Especially beneficial for children because of the format, easy to take, the shot format. And I3.1, I would say long-term treatment for people that have chronic digestive issues like in irritable bowel syndrome or stress-related diarrhea. If you want, since this was a bit, I can write it down for you so that you have it on an email as well. Yeah.
One more question, sorry. Regarding I31, I see that the cover of the capsule or the blister itself, it's different than other packaging. Why?
That I do not know. Maybe Paul can explain. Do you mean that it can open the capsule?
No, not the open capsule.
Okay.
I mean that the blister itself, it's not like a PVC blister. It's something, I don't know if it's just to protect from light or something like this or what. It's special packaging for probiotic or what?
Yes, so let me explain about the blisters. We work with blisters that have a layer that is called aquaba. Right? So since probiotics are
sorry, Paul, what's it called?
Aquaba. I will write it to you down and on an email, and I will send you the information about the blisters and the packaging. The important thing is that since probiotics are live bacteria, they are not like drugs that packaging can be of inferior quality because they will not be affected by the overall conditions of the storage. For probiotics, we do care about the conditions where you store them, and they are more sensitive to any changes. So they're more delicate. So you need to ensure that nothing will affect the probiotics. So this is premium packaging that we have for for our products, because then it ensures that the conditions of water activity, of the temperature, of oxygen, everything is protected with these blisters. That's why we have this pharma grade, but like the best quality that you can find, that will protect effectively the probiotics during the 2 years of shelf life. Because what is difficult is to maintain the product in the good quality for this amount of time. But I will share with you the specifications of the materials that we use with explanations, so you can check it, and you can also promote it this way.
Thank you.